raise your hand. How many of you have ever taken any type of medicine? It should be almost everybody, right? Sure, okay. How many of you have had a doctor prescribe the medicine for you? Okay. How many of you have had a nurse or a parent give you the medicine to take? Okay, all right. Okay, now, let me ask you this question. Did you stop with the medicine after your mom gave it to you or your nurse gave it to you? Did you stop and look at the label to make sure it was the right medicine? Okay. A lot of times we really don't do that. We just trust our mom that she's giving us the right dose, right? Or we trust the doctor or the nurse, okay? So that's what we're going to talk about today. There's sometimes that nurses can make errors when we give medicine. And that's not good, of course. And we're going to talk about how to give medicine safely, okay? So I'm going to show you a little video about a medication error, okay? So I'm going to, as far as it's going to play that for us.
It was November 2007, less than 2 weeks after Dennis Quaid's twins were born, when the actor says the nurse caring for them nearly killed them. The babies, Thomas Boone and Zoe Grace, had been readmitted to Cedars-Sinai Hospital in Los Angeles for a staph infection, but the nurse unknowingly gave the twins 1,000 times the recommended dose of the drug heparin, a blood thinner. Quaid and his wife were in the room, but didn't know anything was wrong until the next day, when they found their newborn twins bleeding profusely.
Their now water-thin blood had the real possibility of hemorrhaging through a vein or artery, causing massive brain damage or failure to one of their vital organs.
Quaid says the twins were supposed to receive 10 units of heparin, but instead got the adult dosage of 10,000 units, a massive overdose that turned their blood thin as water.
How could this happen? Quaid says both the pediatric dose and the adult dose of heparin have similar labels. For the next 41 hours, doctors scrambled to save his children.
At one point, as the doctors tried to clamp a bleeding wound in the remnant of T-Boone's umbilical cord, blood spurted 6 feet across the room and splattered on the wall.
It was the most frightening night of his life. They'd worked so hard to have children. First, trouble conceiving, then miscarriages, and now this.
Our babies could have died that night.
3 other babies did die in Indianapolis a year before. Just like the Quaids, the 6 infants in that case were given adult doses of heparin. Half of them died.
They recalled automobiles, they recalled toasters, they even recalled dog food. But Baxter failed to recall a medication that, due to its labeling, had already killed 3 infants.
Baxter International, one heparin manufacturer, told CNN it had redesigned the drug's vial before the Quaid scare to help doctors identify the right dosage. But Baxter did not recall the older vials, so they were still being used at Cedars-Sinai, where Quaid's children were treated. Quaid sued Baxter for negligence, but the case was dismissed.
Quaid and his wife reportedly settled with Cedars-Sinai Hospital for $750,000. But they say this isn't about the money. This is about protecting patients and doing something about the nearly 200,000 Americans who reportedly die each year due to medical errors. Randy Kay, CNN, New York.
Pretty serious, right? Those little babies could have died because they got the wrong amount of medicine. And medication errors happen every day, unfortunately. Okay? Every day, one patient in the hospital dies from an error. Okay? That could be the wrong medicine or the wrong dose, like in that story. Okay? About 1.3 million people are injured every year. It's a lot. Okay? So as nurses, we have a responsibility to give medications safely. And so there are certain things that we have to do in order to make sure that we give safely. And so we're going to talk about those things today. We're going to talk about something called the 6 rights. Okay? We're going to talk about how to read a medication label, and we're going to talk about how to give a medication. Okay? And then we're going to demonstrate that on our patients using some pills. Okay? So y'all can be people later. All right? Okay. feel better. Okay, yes?
It decreases symptoms.
Decrease symptoms, yeah, okay. Yes. Okay, it could decrease pain. All right, very good. Those are all good reasons. So, since the beginning of time, okay, in history books, in the Bible, in caveman times, okay, you hear of things being used to heal people. Now, it's not Tylenol. Tylenol hasn't been around forever, okay? But they used to use oils, wine. What's going on up there? Oils and wine, even plants they would use to help heal a person, okay? Ms. Garza talked to you about Florence Nightingale, right?
Yeah.
Who is Florence Nightingale? Mother of modern nursing. So she started to have this idea of what we could do to treat people, okay? It wasn't always with medicine, it could have been with something else, right? Making the environment cleaner. And so we're gonna talk about how does a nurse know, or let me see, who administers medication in the hospital? Has anybody ever been in the hospital?
Yeah.
Okay, so a doctor, a nurse, therapists can give medication also, like a respiratory therapist, okay? Let's see, what types of medicines are there?
Pain medicine.
Okay, okay, how do we get these medications? How do we take them? How do we take them? Orally, okay? So we can have pills, right?
We can have shots.
We can have shots, injections.
In our eyes.
We can have eye drops, very good. Eardrops in your nose. Good, y'all are coming up with more than the last class. Huh? Creams, very
You can
good.
take I think an anal suppository.
Liquids,
You can take a suppository.
a suppository, very good. Okay, so we have oral medicine, pills, liquids, things that we drink, okay? We have parenteral medications, that means our injections. We could get an injection in our arm, where else? Like insulin, on our legs, on your stomach, okay? And so, those are injections. We could also get it through the IV, right?
Yeah.
Does anybody have an IV?
Yeah.
Yeah, so we can put medicine right into the vein. There's also something called transdermal, and, Eliza, right? You mentioned like a cream. We also have patches that we put on and the medicine goes through our skin, okay? Yeah, Icy Hot is an example of that. Okay, and then, he mentioned a suppository, that's a rectal medication, okay? Sometimes people can't swallow, or we don't need to put it in an injection, and so we get it rectally, okay? Babies, right? Babies can get Tylenol rectally, right? So there are different forms of medication. So how does a nurse know what medication to give? The doctor has to do what? Prescribe it, very good. The doctor has to prescribe it. The nurse can't just say, oh, you look like you need a couple of Tylenol and you'll be fine. No, the doctor has to prescribe that medicine, okay? So when a doctor writes an order or a prescription, there are 4 main components, and those are here on your slide. 4 main components that are included. The first is the name of the medication. Okay, we have to know what medicine it is. So what's the name in our example here? Tylenol. Okay. The second component is the dose. Okay. What does that mean? How much you're gonna give. Okay. And so here, what is it? 500 milligrams. The third component is the route. What does a route mean?
Like the mouth.
Take the medicine through like the mouth.
Yes, how you're gonna take it, through the mouth, through an injection, through the IV,